Welcome to This Explainer. Today we're diving into something that is quite literally a game changer for heart health. If you, or maybe someone you know, has been dealing with a racing, irregular heartbeat, well, you already know how incredibly stressful that can be. For the longest time, just the idea of needing a heart procedure brought on a ton of anxiety. But there's a monumental medical advancement from 2024 that is completely rewriting the rulebook on how we treat atrial fibrillation, or AFib. We're going to break down exactly what this revolutionary treatment is, how it works, and why it's such a massive leap forward for patients. Let's get right into it. Okay, so let's kick things off with a pretty wild number. 100,000. That's the number of ablation procedures performed every single year in Japan alone. I want to start right there because, when we talk about advanced medical tech, it's super easy to picture some rare, experimental sci-fi thing, right? But this just goes to show that we're talking about a highly accessible, extremely common treatment path. You are definitely not alone in this, and the tech we're exploring today is built on a very established, solid foundation of care. Here is our roadmap for today. We'll be covering the danger of AFib, traditional ablation methods, the PFA revolution, fire versus controlled demolition, inside the operating room, and finally, is this for you? Section 1. The danger of AFib. So at its core, a healthy heart beats in this beautiful, synchronized rhythm. Usually we're looking at about 60 to 100 beats per minute. The upper chamber pumps, and just a fraction of a second later, the lower chamber follows. But in AFib, rogue electrical signals, which, by the way, usually originate from the pulmonary veins, just completely crash that synchronized rhythm. So instead of a strong, healthy pump, the upper chamber of the heart essentially just quivers. It trembles. It's totally chaotic, and it completely prevents the heart from efficiently pumping blood out to the rest of the body. And we really can't just ignore a quivering heart. AFib isn't just some uncomfortable fluttering sensation in your chest. When the heart quivers instead of pumping, blood actually pools inside the chamber. And what happens when blood pools? It forms clots. If one of those blood clots manages to escape the heart and travel up to the brain, it causes a stroke. On top of that, those blood flow issues and microclots can cause long-term damage to the brain, which can ultimately lead to dementia. Plus, just the sheer exhaustion of having an inefficient heart can lead straight to heart failure. So yeah, the downstream risks here are incredibly severe. Section 2. Traditional ablation methods. Historically, we relied on something called thermal ablation, and the concept is actually pretty straightforward. Doctors use a catheter to deliver extreme heat, like literally burning the tissue, or extreme cold to freeze it. By deliberately damaging the specific muscle tissue right between the pulmonary veins and the left atrium, they create a physical roadblock out of scar tissue. Those rogue electrical signals we talked about, they can't pass through that scar tissue, so the heart goes right back to its normal rhythm. And honestly, compared to a lifetime of taking heavy medications, this has been a highly effective solution. But extreme temperatures definitely come with some baggage. Now, the crucial point to remember here is that while serious complications are incredibly rare, they do exist. Think about it. When you apply intense heat to human tissue, the water inside the muscle can actually boil, causing something called a steam pop, which, scary as it sounds, can literally blow a hole in the heart. The extreme temperatures can also accidentally damage neighboring structures that you absolutely do not want to mess with, like the esophagus or the phrenic nerve. Or the burned vein might heal by shrinking and narrowing. Again, these are super rare, but when your main tool is essentially a microscopic blowtorch or liquid nitrogen, collateral damage is just a real risk you have to factor in. Section 3. The PFA revolution. Enter pulse field ablation, or PFA. This entirely tosses those extreme temperatures right out the window. Instead, it uses incredibly fast, high-voltage electrical pulses to poke microscopic holes directly into the target cells. But here is the absolute magic of PFA. It is highly, highly selective. You see, the voltage required to open up tiny holes in a heart muscle cell is totally different from the voltage that would damage the esophagus or surrounding nerves. What that means is the doctor can target only the specific heart cells causing the issue, leaving all those vital surrounding organs completely safe and untouched. It's brilliant. Section 4. Fire versus controlled demolition. To really wrap our heads around this, think of traditional thermal ablation like a house fire. The intense heat violently destroys the cells. They burst open, they spill their contents everywhere, and that triggers a massive, messy inflammatory response in the body. It's chaotic, right? And it takes a lot of time to clean up. PFA, on the other hand, is much more like a controlled demolition. By simply poking those tiny holes in the cells without using heat, the cells never burst. Instead, they just quietly trigger a natural, orderly self-cleanup program. The cellular debris is neatly packaged up and carried away by the body without causing some massive inflammation flare-up. And for the patient? Less inflammation means a remarkably easier and vastly less painful recovery. When we put these two head-to-head, PFA is incredibly fast, usually taking around just an hour. And it boasts extremely high safety because there are zero burns and virtually no collateral damage. Complications are incredibly low. But, it's important to be objective here. PFA is not some magic wand for every single situation. Right now, PFA catheters are designed specifically for the pulmonary veins. So if a patient's abnormal electrical signals are coming from some different, unusual part of the heart, traditional thermal ablation still remains a really essential and necessary tool. Section 5. Inside the operating room. I want to demystify the actual hospital experience a bit because the process is astonishingly streamlined. You're placed under general anesthesia, so you just sleep right through the whole thing. The doctor inserts a catheter through the groin, the femoral vein specifically, and threads it all the way up to the heart. Because PFA is just so incredibly efficient, the whole thing usually wraps up in just 1 to 2 hours. And here is the best part. You are typically up and walking the very next day, sometimes even the exact same day. The total hospital stay is just 3 to 4 days. It is absolutely not the drawn-out, agonizing ordeal that a lot of people picture when they hear the terrifying words heart surgery. Now, if you're wondering how on earth the doctor navigates a tiny tool all the way up into your heart safely, the tech is just phenomenal. They use an advanced 3D mapping system. The catheter actually has a tiny 9mm magnetic sensor right on the tip. Think of it exactly like a highly precise GPS system, but for your heart, building a real-time, three-dimensional map on a screen. And because this GPS is so pinpoint accurate, doctors rarely have to rely on continuous X-ray imaging, which dramatically minimizes your exposure to radiation. Section 6. Is this for you? According to the clinical guidelines, timing really is everything here. The success rate is highest for patients in the early stages, specifically those with paroxysmal AFib, where the irregular heartbeat comes and goes, or those who've had continuous AFib for less than a year. If you have strong physical symptoms that are just completely disrupting your life, this procedure can dramatically improve your quality of life. It's also highly recommended for younger patients, meaning under 60, to ensure a long, healthy life. And for anyone showing signs of heart failure, getting the heart rhythm back in check can literally reverse those heart failure symptoms. Finally, if you just want to free yourself from the heavy burden of taking lifelong antiarrhythmic or blood-thinning meds, you are absolutely a prime candidate to bring this up with your doctor. Which brings us to the most vital question we want to leave you with today. What kind of life do you want to live? Medical guidelines, well, they're just a starting point. Taking charge of your health means looking at breakthroughs like pulse field ablation, not just as some medical procedure, but as a real tool to reclaim your vitality. Whether you're dealing with early-stage symptoms or you're stressed about the long-term risks of AFib, safe, advanced options are available right now that can dramatically redefine your future. Talk to your doctor, weigh your options, and take control of your heart's rhythm. Thanks so much for joining us on this explainer, and we will catch you next time.